So, Rheumatology 2.0, how to leverage social media to become a better rheumatologist. All right? So let me tell you a story about a patient that I saw at the beginning of my fellowship. It must have been Friday afternoon. It's like 4:30. I get a call from somebody's primary care doctor saying, "You have to see my patient right away. His foot is swollen." I'm like, oh my God. Just wanted to go home. But we saw the patient. We asked the patient to come in, and he sort of hobbled, right? He was in clear discomfort. He hobbled into my examination room. And I found out that he was a 70-year-old gentleman with hypertension, hyperlipidemia, and chronic kidney disease, whose foot was swollen and painful for the last 3 days. He's been taking ibuprofen around the clock, and it's not helping. So I asked him to take off his shoe and his sock, and this is what I saw. These are two pictures. What do you guys see? What is this?
Gout?
This is gout, yeah. I was so excited, right? This was one of the first times that I'd ever seen gout before. And his foot was clearly swollen, it was warm, it was extremely tender, and I was totally excited to treat this guy and make him better. So, as a good rheumatologist, I said, I think you can really benefit from some colchicine. So I sent it to his pharmacy in CVS, and that was that. I thought I'd done a great job. The next morning, I get a call from CVS telling me that they didn't fill the prescription, that the colchicine interacted with one of his other medications, his atorvastatin, and so they didn't fill it. And that really shocked me. First of all, that this patient, 24 hours after seeing me, was probably still having pain because he wasn't able to get the medication that I had given. And the other thing, that I possibly could have given him this toxic cocktail that maybe could have done some real harm. So I said, well, what medications? And they're like, oh, the atorvastatin with the colchicine interact. So this was the first time I've heard of it. So I went to Lexicomp and I said, do they really interact? And yes, so I put it in, colchicine and atorvastatin, and they have a grade D risk rating. And grade D risk rating means that you should consider therapy modification. I didn't know about this. So I tried looking it up to date, tried looking at some of the rheumatology textbooks. None of them talked about what you should do if your patient is on a statin and you want to prescribe colchicine. So what would you do in this case? Who would you ask? So asking my attending. So I paged my attending, and it took him a while to get back to me. So I said, I wonder if I tweet this out, if anybody's gonna give me a response. So that's what I did. I went to Twitter and I posted this tweet. And then I tagged it there with rheumatology and with gout to let people know what the topic was about. Within a few minutes, my friend Pradeep, MGH cardiology fellow, responded that he had a lot of patients with cardiac disease and gout who were on statins and colchicine and had no issues. I'm like, okay, that's good. That's one person, and he's not a rheumatologist. Within a minute, somebody else from Spain, Dr. Macia, said she's never seen it. And she mentioned that a lot of patients with gout have cardiovascular risks and probably are taking statins anyway. Dr. Wright, a rheumatologist from Texas, also chimed in within a minute, saying that he's yet to see a problem. From Germany, Dr. Kirsch said that that he wouldn't be concerned, that it's more likely if patients are taking allopurinol. And finally, Dr. Kavanagh, and this guy is a famous Irish rheumatologist who was president of the Irish Society for Rheumatology. So when this guy said, you know what, he's never seen it, I was convinced that it was probably okay for my patient to take this medicine. I called up CVS and I said, you know what, I want you to give him this medicine anyways, because the benefits greatly outweigh the risks. So what I want to tell you today is about my experiences in social media. how I've used social media over the past year. I sort of started it as an experiment just to see what happens. And what I found is that it really changed the way that I took care of patients. It made me be able to keep up to date with the medical literature. It connected me with doctors from around the world. It connected me with patients. And I think it's made me a better doctor. So I put it on Twitter. I put the similar survey that you guys took yesterday, and I asked doctors who were on Twitter, how has Twitter helped you? And this is what they said. So it was on a scale from 1 to 5, whether they strongly agree or strongly disagree with my statement. And so most of them said that it was beneficial. You know, that it allowed them to stay up to date, that they were able to teach and learn medicine through social media, that they were better able to understand patients from the use of social media. They connected with physicians, and they thought that it made them a better physician. So these were 37 rheumatologists, 37 doctors who were on Twitter who were also find it as valuable as I did. So I wanted to compare it to what you guys said. And these are your responses in blue. And the discrepancies are really interesting. So a lot of people that are already using Twitter really think that it's a wonderful place to teach and learn medicine. And also, it's a wonderful place to better understand patients and their illness. So at the end of this talk, I hope that I address all of these things so I can convince you that social media can really make you a better doctor.